When I was a medical resident, now many years ago, I had a professor who used to say, Bill, when all else fails, listen to the patient. And I've always found that to be good advice. Sometimes doctors will focus on a snippet and, for lack of a better term, miss the forest for the trees. Also, patients tell the physician a significant amount of information, some of which may be pertinent and some of which may not. The doctor needs to identify the pertinent information and focus on that and expand his or her line of questioning and taking a history to look at what's pertinent. Why do they sometimes deny or fail to consider what the patient says? Sometimes it's time related. Maybe they're rushed. They have other people waiting. But the long and short of it is, if you have a patient who gives you a history and maybe a workup is ordered, maybe it includes lab work, x-rays, other studies of some kind, and let's just say all of that comes back completely normal, and the patient comes back in, the physician reviews this with the patient, and the patient looks the physician in the eye and says, Doctor, I just know something's wrong. That's something to listen to. I had a gentleman who, exact same scenario, vague symptoms, did the workup that you normally would do. Nothing really showed up. He gave me that history. He said, you know, something's wrong and I know it. Went back, did a CT scan of his abdomen and pelvis, found he had a retroperitoneal sarcoma, a very aggressive cancer that was actually outside of his abdominal cavity, back in the area of the kidneys and the ureters and the aorta. But we picked it up on the CT. We were able to pick it up fairly quickly. He was able to be seen by an oncologist, received chemotherapy, and now he's alive in his very late 80s and still leading a fruitful life. So again, remember that paradigm. When all else fails, listen to the patient.